Hi Blair, my name is Crystal. I'm a University of St. Francis nursing student and I'm here to do the baby's assessment. Is that okay? Yes, thank you. I'm going to do some hand hygiene and then I am going to compare the baby's bands with the mom's band and make sure that they match, and they do. The goal of baby is to keep them warm and comfortable while doing the assessment. The first thing I'm going to do is I'm going to listen to lung sounds, heart sounds, and bowel sounds. That way I can get a good listen. I'm going to listen to them at a minute each in real time. However, in this video, they'll just be shortened for video's sake. I'm going to listen to, when I listen to the breaths, I'm also going to feel here for any shallow breathing that could happen where I wouldn't hear it, but I'll be able to feel it. When I'm listening, I'm going to listen for any apnea greater than 20 seconds because that would be a sign of respiratory distress. Also, if she were to be grunting or if she were to be flaring her nostrils, if I notice any retraction breathing or any seesaw breathing, then those would also be indicative of some respiratory problems. The normal respiratory rate for a baby is 30 to 60 breaths per minute, and the normal heart rate for baby is 100 to 160. So now I'm going to check the temperature under the baby's arm, and that is 97.7 to 99.5 is normal for a baby. And so I've gotten the vitals, and now I will begin my head to toe assessment. I am going to check the baby's head with circular motions. I'm going to check for molding. I'm going to check the fontanelles. I'm going to check the posterior and the anterior, the size of them. I'm going to check the suture lines. I'm going to look for any scratches, bruising that could have occurred from the birth. Also, I'm looking for all over fluid that is called caput succedaneum, and I'm not sure how to pronounce that very well. And I'm also going to check for cephalohematoma, which is blood buildup that usually doesn't cross the suture lines. And as that breaks down, that sometimes can cause a little bit of jaundice. Also with the head, I am going to note suture with the suture lines, and that they can overlap a little bit, causing which is normal for when they come out, and then eventually they'll just in time go back to normal. After I've noted that none of that, no bruising or anything like that, I'm also going to look at the face and check its eyes. So baby's got two eyes, and they need to be about a third apart, symmetrical. I'm going to look at whether or not the baby has epicanthal fold, and this baby does not. I'm also going to look for any conjunctive subconjunctal stuff in the eyes. And this baby does not. I'm also going to look at the location of the ears and eyes and how they measure up. I'm going to check the baby's recoil on the ears, which would be good for this baby. I'm going to now go to the patency of the nares. So I put one finger on one side and one finger on the other, and those are good. I'm now going to glove up, and I am going to touch the edge of the mouth, and I'm going, as the baby hopefully does like a sucking motion, reflex, then I'm also going to check the tightness around that, and also for any cleft. I'm going to check just all around in the mouth for anything, any bumps and such, things like that. From here, I'm going to move down to the neck, and I'm going to check for any masses. I'm going to check the range of motion, and by this time, the baby's probably going to be mad at me anyway, so we're going to check it out on its own. I'm going to feel the clavicles, make sure that they're intact. Sometimes they can be broken or dislodged from the birth. From here, I am going to, if this baby's clothes came off, I'm going to assess the skin. So I would take the clothes off, and I would look at the skin for any bruising, any scratches, any birthmarks, rashes, peeling, just anything other than being pink and precious. So this baby is pink and precious skin wise right here. I'm going to check the areas for jaundice, head, trunk, stomach, thigh, and eyes for sclera for any jaundice. I'm also going to check for the abdomen being round, which it is, and I will palpate it since I already listened, and feels nice and normal. Also, I'm going to take a look at the umbilical cord. The umbilical cord should never be below the diaper, and I'm going to check and see if it's got any discharge, see if it has any redness, swelling, just how dry it is or wet it is. From here, I am going to put my gloves on again, and I'm going to check the baby's genitalia. This is a female, and the labia covers the minora and the clitoris. If it were male, then I would palpate the testes to see if they were distended. I would note the location of the meatus. I would check for any rugae, which is less rugae if they are premium. It has more rugae when they are term. I would note if there's any foreskin, whether or not they've been circumcised or not, and the dressings. I would take a look at that if it were a male and had been circumcised. I'm also going to check the baby's muscle tone. So I'm going to push up for a few seconds, I'm going to pull down for a few seconds, and then I'm going to let go, and they should bounce up like that. So good muscle tone with the recoil. I'm also going to look at baby's feet. At this point in time, it has 2/3 of wrinkles, creases on its feet, so that's good. I'm going to do the Babinski reflex, so up and around, and up and around, and baby's toes went out, and which is typical for an infant, and not typical in an adult. Also, I'm going to check the, it's got 5 toes and 5 toes, 2 feet, we got 5 fingers, 2 hands, and we have more than 1 crease in each hand, so that's good. Also, I am going to roll baby over nice and gently, and I am going to look at baby's spine, no any curvatures. I'm also going to check the back and everything for, again, birthmarks, vernix, lanugo, bruising, rashes, and such. Also, at this time back here, I want to see if there's any dimples, hair tufts at the sacrum. there are not. And I believe that's it for my assessment with baby. So I'll bundle baby up. I will check with mom and find out when the baby last voided, the last bowel movement, how much and when last ate. And that will conclude my assessment on baby.